Hi, I'm Dr. Annalene Weston, Dentolegal consultant at Dental Protection. Welcome to RiskBites, a series of podcasts created specifically for dental practitioners in Australia. RiskBites looks at the key dental legal risks and issues affecting dental practitioners across Australia and provides helpful advice and guidance on how to steer clear of them, leaving you free to provide safe and high-quality dental care for your patients. In this edition, I'm joined by my colleague and fellow dental legal consultant, Dr. Colm Harney, regarding the brave new world of online communication. So the internet and virtual communication, we all know this medium opens the world to us. And in fact, many of our listeners will be what's known as digital natives, having never known a world without the internet and all that goes along with it. Sadly, Colm, you and I are both old enough to remember a time pre-internet. However, by now those days are long gone. The horse has bolted and the internet is here with us to stay.
Yes, indeed. Those times are well and truly gone, Annalene. For dental professionals, it would be wise, I think, to take stock and reflect on something that we now very much take for granted, but what I would consider to be a double-edged sword. Now, I say this from a position of having the benefit of knowing the world as a dentist pre and post the dawning of the internet.
Interesting. So we certainly only tend to view the internet as a positive force to dentistry. So why the double-edged sword analogy, Colm?
Okay, yeah, I see the point. Well, so it's certainly not all doom and gloom and caution. There's no doubt that the internet has brought significant gains for our professional lives. And then there are the obvious things like building an online presence, such as websites, social media profiles, alongside the bricks and mortar of our practice premises. Things like branding and marketing and clever optimization can direct messaging in a much more targeted fashion to our patients. Annalene, you probably remember putting our practice ad in the yellow pages every year.
Yeah, I do. And then you used to have to check and make sure it was there and that they'd spelt your name right.
That's right.
And I wonder in hindsight how we ever found anything. So what are the other games, Colm?
Yeah, and obviously as well, the internet and online presence is a superb tool for patient education. Things like enhancing your branding with that education. You can provide resources to your patients. And it can even assist with things like consent. For example, we do see some practitioners creating short YouTube clips to enhance patient understanding of procedures. Other things like patient engagement and communication. So everything from booking appointments to, if you remember, for 4 years, we were messaging our patients about COVID circumstances as they change. So having that online presence was so helpful. And other things like networking, professional development with peers, both locally, nationally, and the online state of play has opened up the world to us. So globally, global access to our fellow professionals can be instant and seamless. And also clinically, things like records going into the clouds, receiving reports and imaging in real time from specialists, and also the wonderful technology of scanning our crown preps and impressions straight to the lab is really helpful.
That all sounds fabulous, Colm, how the world has changed and made our lives so convenient and disrupted the old, slow, expensive way of doing things.
Yeah, absolutely. It has been a game changer. But at the same time, with every advance comes unintended consequences. One such phenomenon that I want to focus on today is what was identified by Suler as far back as 2004, and he called it the online disinhibition effect. Get your tongue around that one. His article suggested something that we all intuitively know, that people often feel more liberated and less inhibited when communicating online compared to face-to-face interactions. This can lead to both positive and negative behaviours.
Yeah, now we come to it, the lowering of inhibition. So you're saying that this is not always negative, though?
No, not necessarily. A lowering of inhibition can actually, as we probably know, can have positive effects too. Things like self-expression. So the anonymity and perceived distance from real-world consequences online can empower people to share their thoughts, feelings, and experiences more openly. And we all know of supportive online communities such as support groups, forums, they even exist in dentistry, can foster a sense of belonging and provide individuals with a safe space to discuss sensitive issues. And also online space enhances creativity and collaboration. So this online disinhibition can lead to creative collaborations and brainstorming sessions. But there is always a but. There are significant negatives too. From the very earliest days of the internet, various categories of negative outcomes were identified, and Suler has brought these to our attention in the article. Things like words that we all know now, cyberbullying, so the anonymity and reduced empathy in online interactions can lead some individuals to engage in hurtful behaviour. And importantly, I think this is the type of behaviour that they might never consider doing in face-to-face situations. Things like trolling, so using anonymity as a shield to provoke reactions and create chaos. And things like, obviously we see a lot of at the moment, hate speech and extremism, where people feel emboldened in the online space to express extreme views.
And I think just recently I saw an outcome for a doctor who had been suspended for some of the things that they had written on their social media.
Yes.
And I'm just reflecting, certainly over the COVID years, I assisted members who'd put views about COVID vaccination online and got themselves in trouble with the dental board because their views were perceived in a certain way. So unfortunately, Suler really predicted this, didn't he? And we can predict all of these. We see all of these in everyday life. And this is what we have to contend with, bringing our children into this world and our children bringing it into our homes. And I know you and I have children of the same age, and it's something we've discussed offline. So what's going on here, Colm? Why the changes in behaviour when we move from a real world space where we're eyeballing someone in a conversation to the online space?
Yeah, I think that's a key question. And Suler identified the primary factors that contribute to this online disinhibition. Most obvious is that word that we have referenced already a few times, anonymity. And many online platforms allow users to interact without revealing their true identities. And that leads to a sense of detachment from real-world consequences.
Yeah, and I think we've all seen anonymous posts that didn't actually really need to be anonymous, and or the hidden identity of the individual empowered them to be quite unkind.
Yes, we have. And that feeds in a little bit to the second identified factor, invisibility as well. So online interactions, as we know, often lack those physical cues, such as body language and facial expressions. And this makes it easier for individuals to misinterpret messages and express themselves without the usual inhibitions. We also have a thing called dissociative imagination, whereby some individuals create personas or adopt online alter egos. And I think we do see a lot of that as well. And this further distances themselves from their offline identities and can result in more extreme behavior. And finally, something as well that is inherent in the online space is this minimization of authority. So the absence of traditional authority figures online can lead to a lack of social norms and consequences, thus encouraging people to express themselves more freely.
I think most of us would accept these well-recognised issues. And the question is, where are the lines drawn between us in our day-to-day personal lives and us as dental professionals? And when we have to put our dental professional hat on, are we more on guard in respect to our online behaviour?
Yes, now that's a really good question. And there is some literature on this actually from Australia. So there's a study from 2015, so for quite a while ago, but I'm sure it's very relevant still, from the Australian Medical Journal, which surveyed medical students from the 20 medical schools across Australia. And in findings, I don't think any of us sitting here would find surprising. It found that social media use by the study population of medical students was nearly universal. So that's no surprise. However, what may surprise some is that 34.7% of respondents, so roughly about 1 in 3, reported evidence of unprofessional content on their accounts. So this is significant because this unprofessional content was reported despite exposure to guidelines, which had been in place for 5 years since 2010, and education that they had received about online professionalism. And this is quite relevant as unprofessional conduct, either online or offline, as we know, even by a student, may lead to disciplinary action. And it has also been found to be associated with lapses during later professional practice.
When we at Dental Protection review cases and claims, of course, part of what can be very relevant is the communication between patient and practitioner. And many of these communications now can occur online, either by emails, messaging apps, or of course, online reviews.
Yeah, and again, that's something that's quite noticeable. I think when we look at cases, there's more and more communication between practitioners and patients in the online space. And what we have to realize, it's a given that the practitioner must be the adult in the room in all communications. They must engage responsibly, and they also must demonstrate at all times that they have the best interest of the patient at heart. Importantly, Annalene, just because a patient behaves inappropriately online does not mean that we have to climb into the dumpster with them and engage. Sadly, looking over some cases and how they spiral downwards, we do sometimes see instances of the online disinhibition effect in both patients and practitioner communications. And things that we often see examples of, as you know, patients being abusive or swearing in online messaging, which I don't think they would ever do otherwise in a face-to-face interaction at the dental surgery. Things like patients demonstrating impulsive behaviour, so constantly changing their minds, constantly reaching out to the practitioner, discussing cases, changing their mind from one extreme to the other. And the online space gives the opportunity for every unfiltered thought bubble to be offloaded into the practitioner's lap, as they believe they 24/7 access to the practitioner. And again, I think we'd both agree that this erratic behaviour and interactions wouldn't be possible in the face-to-face space.
It wouldn't. And then, of course, when we respond to a patient at midnight, what are we teaching them about our availability?
Yes.
And then, of course, we've got the online reviews which bend or distort facts to suit a narrative or are posted as a consequence of emotional venting.
Yeah, that's something we also see a lot of. And unfortunately, we also see practitioners who inadvertently breach patient confidentiality by, for example, communicating with a party other than the patient about their care. And we know the common trap is a response from the emotive and hurtful practitioner divulging clinical information in a public forum. And other things we see is practitioners giving personal contact details to the patient from a place of, well-meaning, and then getting bombarded by comms from the patient at all times. The problem being here that maybe an emotional or an irrational response after a long day at work, or even coming home in an evening, on Friday evening, and having a few drinks, and you get the patient message at 8 o'clock. We know we're not bringing our best self to the table at that time, and sadly, the evidence is there in black and white for all to see afterwards if the practitioner communicates inappropriately with the patient. Also, and we've done a podcast on this as well, crossing personal boundaries can be a problem as well. So, for example, conversations after a friend request or a follower request on social media, and we have to be very much on guard about that as well.
Yeah, we do. We've seen some doozies over the years. And we at Dental Protection have known for a long time that if practitioners are going to enter this arena and engage in a virtual world, they must not only stay informed and adapt their strategies to remain effective in reaching their audience, but they must ensure they're compliant with the guidelines that were, for example, set down by our regulator. And now we need to add, they need to be mindful of the online disinhibition effect. So what can we do as professionals to ensure we practice safely online, for want of a better way of describing it?
Yeah, I think that's a really important question, and something that you made reference to earlier. I think there is a duty for all practitioners to educate themselves in the responsible use of social media. And this should cover things like privacy regulations, ethical considerations, and also other potential risks that might be involved in social media engagement. Something you alluded to earlier, Annalene, there is actually a professional code of conduct on social media use. It's on the Dental Board website, and professionals should have a good working understanding of these codes. And in fairness, they can help clarify the boundaries and expectations that our regulator has for us. So it's definitely worth a read. I think it's important to be across privacy controls and issues around that. Other things to consider certainly are patient consent. So before sharing patient-related content on social media, healthcare practitioners must obtain informed consent from the patient. So that means, just like our treatment, patients should be informed about the potential risks, benefits, and all other relevant material that's involved in sharing the stories or medical information. And also something that you also referenced earlier around COVID, I think it's important that they fact check and verify material if they are sharing or forwarding material online, because it's important, particularly in their professional capacity, that practitioners should encourage critical thinking and provide credible sources that can help patients distinguish reliable information from unreliable content.
Yeah. And while there's a lot to consider here, and you've crystallized the key points for us, thank you, much of this knowledge is now embedded in culture. So something that maybe we're all conscious of as members in the digital community, do you think?
Yeah, no, I do. But the key point, I think, here is once we move from interactions in the presence of our patients, where we can look them in the eyes, to the online space, we need to be very vigilant of this online disinhibition effect. So that might be where we're provoked into reacting without considering the consequences, or even communicating innocently in a manner where we can't see social cues and signals that may be misinterpreted.
Indeed. And I think it's really useful to bring to the front of mind the possibility that we need to be as, if not more, vigilant in our online communications. So have you got any last tips our practitioners can take away to help them avoid the online disinhibition effect? And I like that term.
Yes.
It's really meaningful, I think.
When you think about it, it makes a lot of sense.
It really does.
Yeah. And last tip, it's a nice simple tip to take away. So I think regardless of any medium of communication, the old adage is now truer than ever in this world of immediate communication. If in doubt about pressing send, sleep on it and it will be there tomorrow. And hopefully in the cold light of day, common sense will prevail. And I think this will stop you falling into a trap where the uninhibited response is sent. And when it's online, it's sent out into the ether, irretrievably there forever. And you may have plenty of time to repent in leisure, waiting for the complaint to come through. But also, finally, we're also here to help too. So it's not just if you have a case or a claim, but as dental practitioners too, we do understand these dilemmas. So in the heat of the moment, or with the red mist descending, having read a negative online review, we can help you take a deep breath and form an objective view on the question at hand and help you respond as the adult in the room.
We certainly can. And thanks, Colm. That's been so helpful. And thank you all for listening. We do hope this podcast was helpful to you, and we look forward to sharing more guidance with you in the future. If you like Dental Protection podcasts and you'd like to hear more, please subscribe and leave a review.